Welcome back to American Medicine Today. It's my pleasure to introduce to the program Bonnie Turon from Camillus, New York.
Thank you for having me.
So, Bonnie, why don't you tell us how you came to be in pain?
I just a degenerative issues. I had delivered mail for 23 years, worked hard. I have 7 acres of property and a lot of working.
Yes.
And I think it's just degenerative. You know, I was 56.
So repetitious motions and lifting and bending, that kind of thing?
A lot of it. Yes, ma'am.
Is it safe to assume you progressively felt more pain as time went on?
Oh, yeah. Oh, I ended up, before I came to you, I was in a wheelchair for about a month.
And so
I literally couldn't walk.
You literally couldn't walk. Goodness.
Literally.
And so what do you do at that point? I mean, if your life is so heavily impacted, obviously, if you're in a wheelchair, I'm not sure that you're performing your job duties and then any daily activities at that point.
Right. I was at the end of my rope. I didn't know what to do. I had seen a doctor in Syracuse and he wanted to do pins and rods and screws and a year recovery, a year in a shell. And I'm thinking, I can't go that long without mowing my lawn. And I got to go back to work. I was working. I love my job.
Yeah.
And my husband walked out of the office and said, I don't care where you go. I don't care where we have to travel. We're going to find somebody else. And a cousin had come down to see you when she was 21. She was actually one of your youngest patients, had unbelievable success. I literally was on the table telling that story as she was delivering her first child that they said she would never have. And Dr. Hirshaw was like, wait, I remember her. So the whole thing was God-given, really, really.
When you say that you were having pain, can you kind of explain, was it a radiating pain or was it localized to one area? Where on your body were you feeling that discomfort?
Mostly my left leg. I couldn't lift it up. I wore the side off my shoes. When I was delivering mail, I would go through a pair of sneakers a month. I would wear the side right off the shoe.
And drop
I couldn't pick my leg. The pain was indescribable.
When you're saying that you wore through the shoe so quickly, were you experiencing drop foot at that time?
Yes. Unbeknownst to me, I just thought I was in so much pain I couldn't pick up my leg and I was just dragging it. I'm an active person. Delivering mail and mowing, and we have 7 acres of property. And I was truly I was at the end of my rope. I didn't know what to do. And I had done a lot of research on Bonati. I made a lot of phone calls. You guys gave me, I believe, 25 references. I actually took the 2 professional football players that literally picked up the phone and said to me, one guy said to me, honey, I don't even have to tell you, just go. You're so blessed. And everyone I talked to maybe 15 other people, and every single one said, oh, you can't go fast enough. And as Providence would have it, I almost believe today was the day Dr. Bonati called me, 2012, honest to goodness.
Of 2012. When you received the phone call from him and he was able to tell you he believed that he could help you, what was that realization like? Considering other doctors were telling you you needed invasive hardware fusion surgery?
He literally called me at home and said, I just got your MRI. He said, we can help you. After I stopped crying, we decided that we would book a flight. We booked a flight that afternoon. We were there, I believe it was 10 days later. I walked in, he greeted me. He put his arm around my shoulder. My husband was in tears. Here we are in Florida. I was in tears. He was in tears. Dr. Bonati kind of poked him on the shoulder and said, we got this. We're going to take care of her. Unbelievable. Everybody was amazing. Amazing.
We utilize something called conscious IV sedation. So the patients are sedated, but they're aware and they're allowed to watch, and you're allowed to have a loved one in the operating room with you. What was that like for you?
It was amazing. I'm a real research person, a real techie person. And when they said that they wanted me conscious, I talked to everyone. We had a couple really good laughs. At one point, maybe an hour into the surgery, Dr. Bonati said, okay, get up on your hands and knees. And I looked at him and I said, not before you see God for lunch. And he said, honey, no, get up on your hands and knees. And I had I must have made a face. I had a little pain. Lay back down, another hour. And I got off the table. He literally, I had a sundress. He said, get in your sundress. I want you to walk a mile today.
Hmm.
I was like, well, that's probably never going to happen. I went back to the hotel. He called me at 8 p.m. As I'm sobbing. I had walked a mile.
Oh, and those were happy tears, right? Not painful tears.
Oh yeah.
And
I can still feel all that. It was, even though it was 12 years ago or 11 years ago, it was so profound. And so it was just amazing. The whole thing. I got off the table and he watched me walk down the hall. He said, now come back. And I'm literally looking at him like, yeah, this isn't going to happen. My husband was sitting there with his mouth just, oh, are you serious? Mm-hmm. And then I had 2 more surgeries. I had stenosis and vertebrae that had herniated again, mm-hmm. and some canal issues with my hip. And he just fixed them all. It was unbelievable, really.
All these years later, how are you?
Better than ever. I literally to this day still walk 5 miles a day. Swear.
5
It's
miles.
amazing. Every day. And he said to me when I walked out, mm-hmm. he patted me on the shoulder and said, walk, walk, walk. And I said, okay, I'll. And someone called me like a year later, mm-hmm. and asked how I was doing. And I said, I'm walking 5 miles a day. And they said, are you serious? And I said, yes. I think it was almost like, it was just like such a challenge. Mm-hmm. I hadn't been walking I'd walked so hard for so long. And then to be able to walk, I would literally get down to the end of my street and say, okay, God, thank you.
It is such a pleasure to talk to someone that has been through so much and kind of saw their life kind of fading before them in a wheelchair. Ma'am. You come down, you have the Bonati spine procedures, and you're immediately up and walking. Thank you so much for sharing your story of recovery with us. Did you have to wear any sort of back brace when you left? Were you told you had to?
You guys sent me home with Band-Aids on my back. Honest to good. We went to the hotel, mm-hmm. and the hotel where we were staying had a lot. Oh, my goodness. There was 20 Bonati patients there. And we had dinner with them every single night, 14 days. The stories were unbelievable. My story was nothing compared to a couple stories. A man had fallen off a building.
Oh, wow.
It was God-given. I could go on and on. I could talk to you all day about this experience, the conscious sedation, being able to talk, being able to see it, hold still, it was so unbelievable. Unbelievable.
You're a living testament to the fact that the Bonati spine procedures are a true fix for spine pain, whether it be neck, mid-back, or lower back. Thank you so much for sharing your miraculous story of recovery with us.
And thank you for Dr. Bonati for putting his arm around my shoulder.
Thank you so much.
Thanks.
And to find out if you're a candidate, visit askbonati.com.